Hi, Dr. Kevin Windisch from Sparks Pediatric and Adolescent Medicine. Welcome to our video series for parents. Please remember these videos are not intended to replace visits with your regular physician. If you have concerns, we're happy to see you here in our office, area code 775-359-7111. We'll get you in same day. We really cannot provide specific medical care over the internet, via websites, via our Facebook page, or via the telephone. We need to see you here in our office. So please, if you need to be seen, see your physician, see us. We're happy to take care of you, but we can't help you over the phone. Welcome to flu shot season. And with that comes, every year, some confusion for parents and patients. So I was hoping to clear some of this up today. And the confusion that I want to clear up is, what is the difference between the influenza vaccine or flu vaccine and the Hemophilus influenza vaccine or the Hib vaccine? Because the question comes up every year, especially with 6-month-old babies when we say we recommend the flu vaccine. The question comes up, well, didn't my child already get that at 2, 4, and 6 months with an additional dose at 12 to 15 months of age? And the answer is no, not routinely. And we don't give it under 6 months. We don't give the flu vaccine under 6 months of age. So what is the difference between these two diseases? Hemophilus influenza, or Hib, is a bacterium. And bacteria are actually living creatures. They reproduce themselves, they breathe air, they eat, they digest, they secrete waste products, just like human beings do. They're just single-celled organisms. Hib is a bacteria. It's a particularly nasty bacteria for human beings. It likes to attack children. And as such, back in the day before we had a vaccine, was the #1 bacterial cause of meningitis, brain damage, and death in children. It also caused some really nasty infections in the face, nasty infections in and around the eye, nasty infections in the lungs, nasty infections in joints. And those joint infections could result in permanent disabling arthritis. Specifically, it caused some blood infections too that were often fatal. Specifically, it was the brain and blood infections that gave a real hard push to develop a vaccine against this, and we did in the early 80s. That vaccine has been routine since it was developed and has almost completely eliminated Hib illness in vaccinated populations. It's given at 2, 4, 6, and 12 to 15 months of age. There's a couple of name brands of the vaccines, but the nutshell is that it's a routine vaccine. Every baby's gotten it since roughly 1985. I'd have to go look at exactly when it was introduced, but roughly 1985. Influenza is a disease that's been around since the beginning of time. It comes in epidemics every winter. Influenza is a virus. It comes in various strains, the A strain and the B strain, and each of those strains has their various substrains, and you'll hear talk about swine flu and bird flu and Hong Kong flu and Beijing flu, and the list goes on and on and on. In the end, it's all influenza. Influenza is a respiratory illness. Causes fever, cough, runny nose. Rarely, it causes a diagnosed viral meningitis, but the viral meningitis with influenza patients tend to get over. The respiratory illness can be severe and can be fatal, and in fact is a major cause of fatality in the elderly and in the young. It is preventable with a vaccine, but because of the nature of this virus, the vaccine needs to be repeated every year. We can have a long discussion about that in later videos, and I have some discussion in some earlier videos talking about why we repeat the flu vaccine every year. as a virus, influenza, both A strain and B strain, is incapable of reproducing itself without help. And that help is the cell it infects. It does not eat, it does not drink, it does not respire, meaning it doesn't breathe. It doesn't produce waste product. It's inert. It's simply a collection of protein and what we refer to as nucleic acids, DNA, only this type of virus doesn't really have DNA. It has a close cousin of DNA called RNA, to be 100% accurate. This vaccine is recommended now for everybody every year, but cannot be given under age 6 months of age. So you did not get it at 2 and 4 months. And the reality is a lot of kids don't get it at 6 months, even though it's highly recommended. And since it is a potentially fatal disease with very little in the way of treatment, prevention is important. The vaccine is important. For young children, the first year is recommended to receive 2 doses given a month apart. And then every year after that is 1 dose. For children over age 2, there is a nose spray that is available. The benefits of the nose spray versus the injection and the benefits of the injection over the nose spray, that's a discussion for another day. And we can have that in future videos. We're not going to get into that today. But that's the one for which there is the nose spray. There is no nose spray for Hemophilus influenza. That one is injectable only. And because of the nature of that disease, will always be injectable only. I don't foresee any changes in the next 40 years. 100 years from now, who knows? I don't pretend to predict millennial changes. But in the short term, the term of my career, and it's 2012 today, over the remainder of my career, there won't be any changes to the Hib vaccine. Flu will be more and more of the nose spray, I think, as we develop better nose sprays because of the nature of the flu vaccine. So, what is the difference in outcomes? Well, kids with Hib, if they got Hib meningitis, they frequently died. We treated it with IV antibiotics, or we treat it with IV antibiotics. Those who survive are frequently left deaf, blind, brain damaged. Kids with the lung infections often died. Kids with the blood infections often died. Kids with the joint infections were often left with permanent arthritis. And again, we just don't see a lot of the disease because we prevent it in everybody. There is no way to eliminate the carrier status, meaning, unlike smallpox where we vaccinated the world against it, now we don't need to vaccinate anymore because there is no smallpox. There will always be Hib. So you will always need to vaccinate your newborns. But after a year of age, you do not need booster shots. You are done. Influenza is a different story. Again, because of its nature, there will probably always be epidemics. And you will probably always need to be revaccinated. It may or may not be an injection depending on time. It is not given under age 6 months of age. People who get it get respiratory illnesses. There are medicines for flu, and we do use them, and I think I have some videos that talk about some of the medicines for flu. But we don't use typical antibiotics. You can get secondary bacterial pneumonias on top of it. If you do, those bacterial pneumonias are frequently fatal. They are treated with IV antibiotics, but those are bacteria on top of a virus as opposed to pneumonia from the virus itself, as opposed to Hib, which causes a primary pneumonia or a primary meningitis. Both diseases are often fatal, so prevention is important in both cases. Influenza needs to be repeated yearly, and for the foreseeable future will continue to need to be repeated yearly. Whether that's a nose spray or a injectable is going to be a matter of the state of the art as research changes, but that's where we are today. I hope this clears up some of that confusion. I know this can be confusing. Why the diseases have similar names, influenza and Hemophilus influenza, is a really long story that I really don't care to get into because it doesn't matter. What matters is They may have similar sounding names. They're not even remotely close to the same disease. And although their prevention is the same insofar as it's a vaccine in both cases, these vaccines are totally different, given at very different times. And one needs to be repeated annually, the influenza vaccine. The other, after a year of age, does not need to be repeated. I hope this helps to clear up this confusion. I know it makes a lot of parents' heads hurt because it is horribly confusing. This is Dr. Kevin M. Windisch from Sparks Pediatric and Adolescent Medicine. If we can be of assistance, we'll be happy to see you here at our office. Area code 775-359-7111. Remember, we can't treat you over the telephone or the internet. We'll see you next time.